Hello everyone. On the occasion of World Breast Cancer Awareness Month, I would like to give a few points to everyone regarding breast cancer, basically the risk factors and the signs and symptoms associated with breast cancer. One of the most important risk factors is actually the female sex. It doesn't mean that it doesn't happen in the males, but the commonest is the female sex. And one of them is actually increasing age. As the age increases, the probability of a person having breast cancer also increases. What is early menarche? Menarche is when the girl attains puberty. It is called as menarche. Menopause is when she stops her menstrual cycle. That's called as a menopause. Earlier and late menarche and menopause respectively actually increases the chance of breast cancer. The basic thing is, whenever there is an increased exposure of estrogen is a female sex hormone in the body, there is an increased probability of having breast cancers. The other risk factors are when a person having a childbirth after the age of 30 years has an increased potential of having a breast cancer chance. And also nulliparity. Nulliparity is when a female has not conceived at all because of so many other reasons. That time also the probability of having breast cancer increases. Then there is a family factor, there is a hereditary factor, which is basically related to BRCA1 and BRCA2 mutations in the body. Everybody would have heard of Angelina Jolie's story, in which she was actually detected to have BRCA1 and 2 mutations, and for which she underwent bilateral mastectomy. The same thing, this carries a very high chance of having breast cancer, these types of mutations. Other things are alcohol, excessive alcohol, obesity, then the modern lifestyles of so many of these of the ladies with all types of type A personalities, and with alcohol consumption and working late hours and not eating properly, not exercising properly. All these things also contribute to occurring of breast cancer. And also with oral contraceptive pills. It has been shown that people who have consumed oral contraceptive pills for a long time, they have a probability of having breast cancers. And also there's something called as the hormone replacement therapy, especially in postmenopausal females who take hormone replacement to keep themselves young or to keep the levels of the hormones intact, also have an increased tendency of having breast cancers. There are other factors like if in the family, first degree relatives and second degree relatives have breast cancer or an ovarian cancer or a pancreatic cancer or a prostate cancer less than 45 years of age, they also have a very high chance of having breast cancer in the long run. So all these things are some of the important factors for causing breast cancers. But how do we detect whether this particular person, or what are the signs and symptoms this particular person has when she is having this particular type of breast cancer? Usually the commonest thing which a lady will complain of is a painless lump in her breast, which is not causing any problems as such, but it is a painless lump in the breast which is increasing slowly over the months. When such a thing happens, it is a sign that she has to go to a doctor to show this particular type of thing. Many times it might be just a benign condition, may not be associated with breast cancer. Until otherwise proven, we have to take it as breast cancer and we have to rule it out. The next thing is, sometimes this lump starts to become big within a very short period of time. This is one of the signs and symptoms of a person having breast cancer. And sometimes there is also discharge from the nipple, usually a bloody discharge from the nipple, or a whitish or a bloody or a pus-like discharge from the nipple, which is also one of the signs of breast cancer. And some patients also complain of lumps in the axilla, that is the armpit, and in the neck also, which could be that the breast cancer has spread from the local area to the armpit or to the neck. Sometimes when the cancer becomes too big and it is locally advanced, that time there could be some ulceration and bleeding from the skin, which is one of the signs of advanced cancers. Then there could be some cauliflower-like growth on the breast, which is also one of the indications of an advanced cancer. And there could be redness and hardness of the skin on this particular area, which is again a sign of advanced cancer. Now let us come to a situation in which the cancer has spread not only from the breast, but it has gone to other areas like the bones or the brain or the lungs or the liver. that time the symptoms are different. The patient might complain of severe backache, or she might complain of headache and nausea and vomiting, or she might complain of breathing difficulty based on where the tumor is and where the tumor has spread to, and sometimes abdominal pain. And all these things are signs of an advanced or metastatic, means it has spread from point A to a different location in different part of the body, and these are the signs of the breast cancer signs and symptoms. Thank you.